Good morning, everybody. Today I'm here to talk about the adrenal medulla, one of the important topics from the endocrine glands. The adrenal medulla forms 20 percentage of the in the mass of the entire adrenal gland, which is developed from the chromaffin cells and forming 20%. Already I told about it. And coming to sympathetic innervation and sympathetic postganglionic fibers modified to become endocrine cells to secrete the catecholamines on sympathetic stimulation. It is synthesized from the precursors or amino acids like tyrosine and phenylalanine, where L-DOPA is converted into DOPA, then DOPA to dopamine, and from there norepinephrine and epinephrine are formed. In the metabolism, it is metabolized by the liver and kidney, appears in urine as a metanephrines and normetanephrines, as you can see in the slide. Under the regulation, various kinds of stress and shown in the slide stimulate sympathetic nervous system, which causes preganglionic fiber stimulation and releases acetylcholine, acts on nicotinic receptors, which increases sodium permeability, which causes depolarization of the membrane by influx of the calcium. By exocytosis, releases catecholamines into the blood. The receptors on which the catecholamines acts are called adrenergic receptors. They have been classified into alpha, beta. Alpha further divided into alpha 1 and alpha 2, beta further divided into beta 1, beta 2 and beta 3. Under the physiological actions and a major role in stress by flight or fight reaction by adrenal medullary system. Carbohydrate metabolism causes hyperglycemia by glycogenolysis and gluconeogenesis. Fat metabolism causes proteolysis and calorigenesis by increasing BMR. CVS, overall activity of the heart increases. CNS, catecholamines activate RAS, reticular activating system, and causing arousal and alertness response. Pupil, causing dilatation of the pupil. GIT, relaxation of smooth muscle, contraction of intestinal sphincter. Urinary bladder relaxes detrusor muscle, contraction of urethral wall sphincter. And in RS, bronchodilation, skin piloerection of the hair and sweating. On blood increases RBC, WBC and hemoglobin PCV count. Blood vessels causes vasoconstriction. In smooth muscles, vasodilatation in exercising muscle, increasing the blood flow to that exercising muscle. These actions are specially on CVS, as I mentioned in the previous slide, and it increases overall activity. Particularly, epinephrine increases heart rate and decreased by norepinephrine. Cardiac output is increased by epinephrine and decreased by norepinephrine. Peripheral resistance decreased by epinephrine, increased by norepinephrine. And systolic BP increased by epinephrine and norepinephrine. Diastolic BP is decreased by epinephrine and increased by norepinephrine. So mean arterial pressure decreased by epinephrine, or there will be no change, whereas norepinephrine increases its effect on CVS. Applied aspects of the catecholamines, and the disorder is called pheochromocytoma. It's a benign tumor of the adrenal medulla. The clinical features includes episodic and non-episodic hypertension due to baroreceptor wrong signaling, attacks of tachycardia, palpitation, sweating, pallor, headache, and chest discomfort, abdominal pain, vomiting, constipation, weight loss, and weakness. The treatment could be surgical removal of the tumor. Thank you for patient listening of my lecture, and please like and subscribe the channel.